Hey everybody, talking a little bit more about recovering after surgery for sesamoiditis. Typically these are weight bearing procedures, meaning that you're in a post-op shoe, but sometimes when we do that proximal metatarsal closing base wedge osteotomy, it is where you're going to need to be on crutches for about 2 weeks. And this is a conversation I have with my patients before we undertake surgery, so they know what's expected and what the right procedure is for them and their life, of course. Most people are going to be getting back to seated work at about 2 weeks, where I do prefer them to have their foot up, making sure that there's minimal edema or swelling that's occurring due to gravity and those post-operative effects whilst the tissue is healing. But most people will get back to standing activities within about 6 to 8 weeks, so that's working. But those that are undertaking more impact type of activities, they may need a little bit longer, up to that 8 weeks, potentially a touch more. But where I can, I do try to get people back into their jogger around that 4 week for if they've had a sesamoidectomy or partial sesamoidectomy. And for those that have maybe had that closing base wedge osteotomy, it might be closer to a 6 week before you're back into jogger, just to make sure we're getting that good bone healing that we're after. And again, I'm typically going to be putting patients into an orthotic just so that we can really ensure that we've got some nice offloading that's customized to our patients. Getting back into walking is really dependent on pain levels. This could be as soon as 6 weeks, but definitely when we're looking at those metatarsal base procedures, we're going to be looking more towards that 12 weeks or 8 to 12 weeks, again, depending on pain. You know, it's more than just walking around the house, and we want to make sure people are not causing more injury or too much pain during that period. So everyone's quite variable. And similar, back to sports can take up to that 12 weeks. And you know, once we're getting that pain right under control, most people get back to it very quickly. But hopefully this has given you a little bit more information about recovering after surgery for sesamoiditis. If you liked what you've seen here, hit the subscribe button, check out some of our other videos, and hopefully I'll see you there. Cheers.